Hi everyone, my name is Alicia Kelly, and the title of my presentation is Intellectual Disabilities and Aggression. Intellectual disability and aggression. Individuals that suffer from intellectual disabilities often have extreme bouts of aggression that reoccur episodically. The lack of one's ability to communicate effectively is the number one reason for aggression. Before, behavioral reinforcement procedures were widely used with individuals with severe or profound intellectual disabilities. Those individuals were frequently medically sedated and warehoused in institutions where they became living zombies. They walked around in a trance with no comprehension of their cognitive or physical abilities. Systematic reinforcement programs were discovered, and once these programs were implemented in these establishments, the individuals began to realize and understand their abilities and inabilities. They began to learn how to dress themselves, make simple choices, and learned important life skills. Their personal hygiene behaviors changed, their choice of food. This empowered them to want to apply themselves in social communities. They finally felt the need to live. This was and still is freedom for them. Identifying factors for aggressive behaviors. There are 4 factors that are prevalent: environmental causes, family and psychosocial factors, medical disorders, and psychiatric disorders. The research design and method. The research question that will be identified and addressed is what causes challenging behaviors in individuals with intellectual disabilities. The research design that would be most effective would be the mixed methods approach using an observational research study. Questionnaires, surveys, and interviews would be implemented to determine what the triggers are that cause these individuals to experience recurring aggression. The individuals would be randomly selected by way of process of elimination, for instance, whether or not they have moderate to severe aggression bouts, as well as their cognitive abilities to understand what makes them angry. Intervention treatments will be provided as well as resources that are accessible for the individual. A combination of qualitative and quantitative methods will allow data to be accumulated with both descriptive as well as numerical statistics. According to the evaluated results of the participants, they will be informed of the processes of the research study, the reason for the study, and most importantly, they will be required to sign informed consents of the participants of the study. There will be no motivational offer for participation. Literature Review 1. Intellectual Disability and Co-occurring Mental Health and Physical Disorders and Aggressive Behaviors. 1 to 3% of population are affected by some mental health disability. Slightly more males than females have recurring aggression. More prevalent in SES and in minority groups, especially for mild intellectual disabilities. There is no difference for more severe levels of intellectual disabilities. The significant limitations both in intellectual functioning and in adaptive behavior as expressed in conceptual, social, and practical adaptive skills. We need to understand the basis of the disability before a proper diagnosis is made and treated. Treating these individuals as equals can give them more encouragement and empowerment that can enable these individuals more choices in a life, allowing them to have a better quality of living. Doing research within this study group will enable the researchers to identify the prevalent factors associated with intellectual disabilities and aggression. It will help them to understand how to prevent bouts of aggression and hopefully be able to prevent the onset of behavioral challenges due to their illness or disorder. Literature Review 2. Analysis of aggression. Evaluation of aggression. Categorize types of aggression manifested. Determine the frequency and intensity of episodes. Identify triggers and stabilizers of behaviors. Identify the environments, people, situations that are associated with the aggression. Include family, child, and outside data. Get estimates on how long aggressive behavior episodes last, specifically looking for environmental, lifestyle, and external factors, psychosocial and family factors, and aggravating psychiatric disorders. Cognitive abilities and academics. The negative impact on education for individuals with intellectual disabilities is 61% failure rate. Thank you, and I hope you enjoyed this presentation.